So let's start with the various terminologies used in anatomy. The first one is the ventral or anterior, which means in front. Now in this case, like in a human body, this portion is the ventral, which is in front. Okay, this is ventral of the face, anterior part of the face, neck and thorax. And in case of upper limb, this is the ventral part, and in lower limb, this is the ventral part. Okay, whatever comes in the front is the ventral part. Now our next terminology is the dorsal or posterior, which means the back. Now this is the back of the thorax, back of head and neck. Okay, this is the back, this is the ventral part of the human body, of upper limb, lower limb, thorax and the head and neck. Okay. Now the next terminology is the medial. Medial means the plane close to median plane. This is the median plane. Okay, this is the median plane. This. And the plane which is close to the median plane is the medial border. Okay, medial border. Then the lateral border, the plane away from the median plane. Okay, is the lateral border. In upper limb, lateral border is this is the lateral border. This is the lateral border. This is the lateral border in the upper limb, and in the lower limb, this is the lateral border of the body. Okay, and the medial border is this one is the medial border. That is the plane which is close to the median plane. So this plane is close to the medial plane. That's why it is known as the medial border of the lower limb and the upper limb. Okay, this is the upper limb. This is the lower limb. So then the next terminology is the proximal, which is also known as cranial or superior. Okay, now this is the proximal part, or the cranial part, or the superior part. Upwards is the superior, cranial or proximal, and downwards is the distal, caudal or inferior. Okay, close to the head end. Close to head end of the body is the proximal, cranial or superior, and close to the lower end of the body is the distal, caudal and inferior. Now the superficial, it is close to the skin. If like this is the layer of the skin, then this part is the superficial part, that is the close to the skin, and this one is the deep part. Okay, that is away from the skin. Then the ipsilateral means the same side of the body as another structure, same side of the body. Okay, like if we are talking about this lower limb, this one. Okay, then any part in this side is the ipsilateral, and the contralateral is the opposite of the ipsilateral. Okay, opposite side of the body from another structure is the contralateral, and same side of the body as another structure is the ipsilateral. Now the invagination and evagination. The projection inside projection is known as invagination, and the outside projection is known as evagination. Okay, now the palmar aspect, front of the palm. Okay, front of the palm is known as the palmar aspect, and the back side of the palm is known as the dorsal aspect. Now the flexor aspect. In case of upper limb, front of the upper limb is known as the flexor aspect, and the back side of the lower limb is known as its flexor aspect. Okay, when the origin and insertion come close to each other, that's the flexor aspect. And the extensor aspect, back of the upper arm is known as the extensor aspect, and front of the lower limb is known as the extensor aspect. Okay, is it clear? Now we will talk about the dorsum, uh, dorsum of the foot. Upper part of the foot is the dorsum of the foot, and the lower part is the you know that it's the sole of the foot. Okay, sole of the foot. Well, in our next video we will talk about the various body movements. Thank you.